Hi, Temple. All right, so I'll jump into it. In 2008, I went to my OBGYN just for my normal annual exam. And you know how you're in an appointment and someone kind of does the kind of that sound effect when you know something's wrong. You don't know what they're going to say, and you hate to especially hear that sound effect when you're at the OBGYN having your normal annual exam. So my normal OB kind of made that sound effect, and I kind of was like, what? What's wrong? And she felt kind of a lump on the outside of my pelvis. And she said, hey, I'm feeling something. It's probably nothing, but I'm feeling something. You should go have an ultrasound or a sonogram to check it out. And so I did. And when I went to have my ultrasound, they found two fibroids at the time. So in 2008, they were about the size of a golf ball. And I should have brought a golf ball with me, but you guys know what a golf ball size is. So in 2008, they found two fibroids on my uterus. And at the time, I wasn't in a relationship, I wasn't married, but it was a little bit concerning to me. But they said, hey, if you're not trying to get pregnant right now, since you're not having any major symptoms, let's just keep an eye on the fibroids. And so at the time, I was having some back pain that they attributed to the fibroids. But other than that, I was lucky. I didn't have a lot of issues. So we just kept an eye on it, and each year I would go back for my annual exam, and every year they would send me for an ultrasound, and every year the fibroids were getting larger and larger. And so by 2015, what started off as golf ball sized fibroids had turned into grapefruit sized fibroids. By 2015, I was married. I had been married for 3 years. I was in my mid-30s, and I had started thinking about, well, gosh, at some point we'll want to have kids, and what do I need to be thinking about in terms of these fibroids? So my normal OB said to me, hey, you're not having any major symptoms. Where they were located, she actually thought that I would be okay getting pregnant, but the fear was, would I be able to stay pregnant? Would the fibroids just kind of crowd out my uterus to the point that it would take, kind of blood and space away from the baby? And ultimately, would I be in so much pain that I wouldn't be able to deal with it? And she said, kind of, let's not experiment with this. Why don't you get them removed? If you're thinking about having kids soon, why don't you get them removed? So in my case, my normal OB suggested a myomectomy. She said the recovery period would be 4 to 6 weeks. And my OB and I started playing the scheduling game. I was going to just have my normal OB do the surgery. What happened though is my normal OB, this isn't what she does full time. Full time, she deals with a range of gynecological issues. And so getting hospital time was difficult. So for months and months and months, we tried to play the calendar game. I had just started a new job, and so it was hard for me to imagine taking off 4 to 6 weeks. And so I was trying to schedule it around the Christmas holidays where maybe my coworkers wouldn't realize I was gone for 4 to 6 weeks. But we just kept trying to play the schedule game, and we just couldn't figure it out. At the same time, kind of a friend, my sister, my mother, several people kept telling my sister and my mother and my friends about CIGC. And they kept saying to me, hey, just go check it out. What's the harm in checking it out? And so finally I went for a consultation. Like I said, in 2015, my fibroids at that point I knew were about grapefruit size. And when I went for my consultation, Dr. D explained what was going on with my fibroids to me in 5 minutes. She was able to explain to me better than my OB had explained to me in 7 years. So every year I would go to my normal OB. Every year my normal OB would try to explain it to me, and I kind of was like, okay, I don't really get it. And Dr. D really drew a picture for me and really explained to me what was going on. She explained to me where my fibroids were located and explained to me the risk of not having them removed. And so in less than 5 minutes, Dr. D said, hey, what we do here at CIGC would enable you to be out of work only for about a week, maybe 2 at the most. And right then I said, all right, let's do it. Not only was I only going to be out of work for maybe a week or so, but also Dr. D said, that my recovery time would be short, and also that I could get in for the surgery pretty soon after that consultation. So whereas with my normal OB, I was trying for months and months to try to find hospital time when the OB was going to have a chance to do it, Dr. D said, okay, we can do it in about 2 weeks, and the timing worked out perfectly for me. So I went in, I had the surgery. I went in on a Tuesday morning. I traveled from New Jersey down to Maryland, and I went in early in the morning, and the surgery didn't last very long. And afterwards, my parents actually live nearby, so I went to my parents' home, and I recovered there. Later that day, I was eating chicken noodle soup that my dad made for me, and I already felt fine that day. I took some pain meds that day and the next day, and already by day 2, I was watching TV and feeling great. Let's see, I had my surgery on Tuesday, Sunday, so just 4 or 5 days later, I went to a football game, Steelers versus Ravens. My parents thought I was crazy. They kept saying, oh my gosh, you just had major surgery. Are you okay? I don't think it's a good idea. But I felt fine. And I went to the game, had a great time. My dad's a Steelers fan and my husband's a Ravens fan. So it was a great time to be there. I was at a football game 4 or 5 days later. And by the following Monday, I was back at work. I felt a little bit bloated afterwards, but I had no pain. I stopped taking the pain medication maybe 3 or 4 days later. And fast forward 2 years after that surgery, or actually a year after the surgery, I was pregnant. And 2 years after the surgery, I have a beautiful 5-month-old baby girl named Emerson. So in terms of the process of getting pregnant, what's funny is the following January after my surgery, my husband and I said, hey, we should probably start trying here pretty soon. I was 35, we all fear that mid-30s age of trying to get pregnant. And we started talking about, hey, we should start trying pretty soon. But before we could try per se, you know how we all track our cycles and all that stuff. Before we started doing any of that, I took a pregnancy test and found out I was already pregnant. And so for me, getting pregnant was not particularly difficult once I had the surgery. I kind of surprised myself and got pregnant before I even really tried. And just, thank goodness I didn't have any issues. Let me back up really quickly. When I had the surgery in December, 3 or 4 months after the surgery, CIGC will tell you to go have, it's called an HSG, I believe, where they check in, just make sure that your reproductive organs are working. They put dye through your fallopian tubes to just make sure everything's clear. And so since I was living in New Jersey, I'm done up in this area. So I had a doctor who I had just met who worked at a fertility clinic do this procedure for me to just make sure everything looked good. And what was kind of hilarious is the doctor kind of did the procedure and he said, "Is this procedure done again? Normally people have this after a major surgery." And I said, "Yeah, I just had surgery 3 or 4 months ago." And he says to me, "Gosh, whoever your surgeon was did an amazing job. I cannot even tell you had surgery. He must be a really great surgeon." And I said, "Yeah, she is. Dr. D did an awesome job." So I had a great recovery. I was back on my feet a week later. And like I said, 2 years later, my baby daughter, I can hear her screaming in the background. My husband's putting her down for bed now. It's been, an easy process. So what are your questions? Give me some questions to answer. I know Dana asked me before I went on what were my fears. So I will say when I went in for my consultation, like I said, Dr. D made me feel so comfortable and helped me understand what was going on really quickly. But then I almost felt like, was I making too rash of a decision? Because as soon as I met with her, I was like, all right, let's do it. And so then I went back home and thought, well, gosh, that was quick. I got it scheduled. I'm doing it in a couple weeks. But I did a little bit of research on Dr. D, and she's the former head of a department at GW. She, clearly is very experienced, and just the fact that at CIGC, this is pretty much all they do, this kind of surgery. I just felt comfortable that they were experts, and I then ended up not having that many fears. Just asked, how was my pregnancy after surgery? Oh, good question. I had a really easy pregnancy. I almost sometimes feel guilty that it was so easy. I didn't have any pain. I didn't have morning sickness. I don't know how I got so lucky, but I had a really, really easy pregnancy. I will say I did end up having a C-section. And so Dr. D, I should add this to the story. My normal OB, when I went for my sonogram, saw 2 fibroids. When Dr. D did my surgery, they found 6 fibroids. 4 of them were hidden behind the large grapefruit size 2 that my normal OB had seen. So she ended up having to do a little bit more finagling to get the 6 fibroids out. She cut them into smaller pieces to remove them. And so when I came out of surgery, Dr. G kind of suggested to me, hey, when you went into surgery, we thought you might be able to have a vaginal birth, but just to be safe, because we kind of had to cut you in so many places and pull and tug so much, I would suggest you have a C-section. My doctor, my OB, when I got pregnant, agreed. And so I did have a C-section, but they used the same incision that was used for my laparoscopic myomectomy that Dr. D did for me. You can't even see the scar. So pregnancy was easy, delivery was easy. Like I said, I feel almost guilty about how easy my pregnancy was. What other questions do you guys have for me? If it wasn't bedtime, I would bring Emerson in here so you guys could wave at her, but just trust me, she's really cute. What type of fibroids did I have? I'm not sure, Lakshmi. I'll have to get the doctors to follow up with you. I kind of just trusted them to know what was going on and didn't research that much, so I'll get them to follow up with you. Dana, what are some things I can do now that I couldn't do before? So I will say, even though I didn't have a lot of symptoms, I did have a lot of back pain. And so that sometimes would interrupt my ability to work out, or mostly to work out. I wanted to be more fit. I had been a runner growing up, and so I had stopped running because I had so much back pain. And after my myomectomy, I was back to running, not worried about my back pain as much anymore. Ebony, do I find that my cycle lasts longer after the surgery? No, I didn't have any change in my cycle. In my particular case, I didn't have a particularly heavy flow. I didn't have a long cycle. So in my case, that didn't happen. I've heard of that happening with other people, but that was not my situation. Other questions for me, guys? Did I forget anything? I would just say that with CIGC, this ability to schedule the surgeries conveniently around my schedule was a big factor in choosing them. Just the experience that Dr. D and all the doctors at CIGC have was obviously a factor. And then just the recovery time. Like I said, I had just started a new job, so I really was reticent to take 4 to 6 weeks off of work. And the fact that I was back at work less than a week later, just, no one could ask for better. How big was my incision? So they went in through my belly button. So there's a little pinhole that I can't even see in my belly button. And then down in my bikini line, I don't know, I've never measured it, but I would guess maybe not even 2 inches or so. So it was a really small incision. To be honest with you, I can't see it now. So I can't even remember back to how long it was, but it's right in my bikini line and maybe 2 inches wide, but small enough that I still wear bikinis. Any other questions? All right, I'll give you guys like 15 seconds. Let's see, Jess had asked me beforehand what made me take the leap, and it was just the idea that I just didn't want to be in pain when I was pregnant. I wanted to give my child the best chance for an easy pregnancy, even for my baby, not just for me. And so once I went to Dr. D and I saw how much experience she had, it just was a no-brainer. And recovery was easy. It was pretty much a seamless process. I almost feel like there's not much to say because it was so easy. All right, any other questions, guys? Well, thank you for joining me. There will be a follow-up from the doctors at CIGC, so check their website for follow-up videos. Thanks for joining me. I'm really happy to kind of share my testimony that it was such an easy process for me. Oh, that's interesting. So Temple wants to know, how's my relationship with my normal OB after the surgery? That's a really good question. So in my case, I was a little bit disappointed in my normal OB that my normal OB wouldn't recommend that I go to a place like CIGC. And so in my particular case, I changed OBs, and my new OB, was obviously a big fan of CIGC, but my previous OB, honestly, I was just disappointed that this option was on the table and that my normal OB was even willing to put me through a 4 or 6 week surgery without recommending a place like CIGC. So, my new OB is, so excited that I didn't have a lot of scar tissue or any scar tissue and that I had an easy pregnancy. And so they're a fan of CIGC, but at the time, my OB that I had, I moved on from that person. So, All right, thanks guys. Like I said, just happy to share my testimony. I think as women, we need to talk about these things more often because a lot of us are struggling with things that, if we just kind of would share our story, we would, all have a little bit smoother go at this thing called life and motherhood and fertility. And so I'm proud to be able to share my testimony. All right, thanks guys. Have a good night. Bye.